Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hello, everybody. I'm Peggy Smith, the holistic nurse, and our guest today is Dr. Robert Butera, founder of the Yoga Life Institute. Bob has been training yoga teachers and yoga therapists for many years. He's publisher of Yoga Life magazine, and he's got a lot of things to talk about today, so we're going to get started. He's published 6 books on yoga, meditation, and yoga therapy. Was originally trained in Mumbai, India, with a Master's of Divinity, and Dr. Butera had lots to tell us today about especially his yoga therapy program that's been doing very well. Hi, Bob. Are you ready?
I'm right here. Nice to see you, Peggy.
Hi. Great to see you. So, do you want to give us a little background, maybe, of where you started and how far you've come?
Sure. It was unexpected. I had been an overseas student in Asia, in Japan, and Taiwan, and I was getting very interested in meditation and all things natural. And from nutrition to exercise, meditation, all the different components that you would hear about. And one of my mentors said, "I think you'll like yoga the best." And he said he was going to send me to a yoga class. And this is kind of the story. So I'm in Japan and living at this community, just finished college, working a little bit. And he comes up with an address for India. And I started laughing. And it was a Mr. Miyagi moment where you laugh at the master. And he was not pleased with my laughter at that time. And he was dead serious that I should go to India and study at a place called the Yoga Institute. And I thought he was crazy because I was fluent in the Japanese language at the time. And I was thinking I was going to have some sort of, relationship with everything there. And I ended up going there and quickly basically understood what he was talking about. I had all those varying interests. And when I went to this Yoga Institute, which, obviously I accepted his advice. He was totally right. And they covered nutrition, attitude of life, attitude of work, meditation, yoga practices, fitness, nutrition, everything that I had interest in for like what would make a totally healthy life, except it was under one roof. It was in one system. Whereas before I would go to study something, in this area, and then I'd find a teacher of that subject, meditation over there. I might go to a yoga class and so forth. So being trained there, I was trained then as a yoga therapist, which means a kind of health counselor. In our system, you would be similar to like a psychotherapist, but there aren't those credentials in our culture. It'd be like having a master's degree in yoga, where you understand both the practices and the mindset. And that's what then I think the easiest thing for the viewers to understand is when you apply these practices that I then experienced firsthand and then came back to the United States and continued to pursue it. I did a PhD in yoga therapy. Again, because when I was doing a master's degree to be a school teacher, my yoga classes were so large that one of my professors said, "You should go further with the yoga," just like the guy in Japan said. And then she recommended getting a PhD in yoga therapy, which she researched and found. And I ended up doing that at the California Institute of Integral Studies.
And I believe that's where you're at now?
Yeah, so I'm now in Southern California after having a yoga institute in Pennsylvania for 25 years, right next door to where Peggy is right now. We're old friends.
So, well, that's really neat. And what you've discovered in India is actually the definition of holistic. Literally. And, that's great. Um, have you? Let me make sure we're okay. Can you go on a little bit in like how you what the training programs involve? People that come to you for the whole program. That you do a lot on virtual now, right?
Yeah, so our training translates very well, actually, unexpectedly. We had online components to our courses with some of the homework modules previous to COVID. And then when COVID hit, obviously all of our offices closed down and we were forced to be online, and we kept things going for our students. And now we have the course completely online. But to become a yoga therapist, you would be first a yoga teacher, and then which is usually a 200-hour commitment and training hours. And then this yoga therapy is an additional 800 hours. So
Okay.
you can see that it's not even like it's similar to a master's degree. It takes at least 2 years minimum. People do case studies, which would be like a practicum,
Mm-hmm.
where you'd be practicing under supervision. There's mentoring involved, and I think I might like to highlight for your clients. Many of them probably have tried a yoga class at this time, or at least heard about it. And when I was, from my experience in India, one of the things you learn is that the idea of a yoga class never really existed as much as a small group or even an individual class. So typically, traditionally, yoga was taught individually so that the needs of the student could be directly addressed and the interests. So when we do the yoga therapy, we're recreating that individualized approach so that if say you're a person with asthma, or you have high blood pressure, or you're training, to be a nurse, and you have a lot of homework and you're feeling stressed and anxious, we have ways of helping you understand the root causes of all that. And then we have different things that you can do to strengthen your mind and body as you go through whatever process you're working
Okay. So you're sort of teaching self hypnosis too.
on. Absolutely. Or
Um,
at least when you do your hypnosis and you have your breakthrough,
mhm.
we would be like looking for that breakthrough and then supporting it with different behavioral practices.
Okay. And you don't have to work under the supervision of any kind of medical field people in America, right? You can just do it as you've been doing it.
Yes, we are. How would I say this? Yeah, we are more similar to the way that a psychotherapy, well, I guess that's true. Psychotherapy is a licensed field. At present, our field is not licensed.
Okay.
So people will technically, yoga therapists themselves know the importance of mentoring. And so they'll typically find a supervisor, actually, and they will be able to have support in that process. But yes, it's more of being like a teacher,
Okay.
if you know what I mean, um, versus a kind of clinician. That's where we work with the various healthcare providers. I was going to say, when you were talking about like this is kind of all the holistic rolled into one.
Yeah.
It's very complementary. That's how we like to look at it in terms of um, the insurance companies and the system that we have in healthcare in the United States doesn't support natural
Right.
interventions or preventative medicine. So that's where we come in.
Okay. Yeah, they are beginning to go towards integrative medicine, which has been a big help.
Yes,
But
we
even
would
my
love.
own integrative doctor in Westchester, she told me that if you want to promote healthy lifestyles, the insurance company pays you less money because it takes you more time to do that. They actually
Yeah,
are penalizing her for doing that.
exactly. And
So,
I've heard there's a few health systems where you get rewarded for your patients being well, and you get paid higher. I've heard in England they do this system, and whereas here, like you said, it's the reverse. So one of the things that we stress with people is that you really have to manage your healthcare yourself. And we like to train people to shift the attitude from being a patient. It's just a name, but if I'm a patient, I'm very powerless. I sit still and I wait for instructions, and then I do whatever instructions they give me. But they never are given eat right. You must exercise. You maybe need to do some meditation or stress management activities. You're never given those things, or at least no support for them. So I like to tell people, don't be a patient, be a student of health.
Okay.
That's a
One of the
punchline.
goals of this whole series is to help empower patients, or I call them medical consumers now, to just be proactive for their own health. And, because I've had people come to the hypnosis office who say, can you tell me how to tell my doctor to F himself? And I'll say, no, I can't, but I can explain to you why he's telling you what he's telling you. And you can go back and have an intelligent, informed conversation and collaborative discussion with him. And everybody like, oh, I didn't know I could talk to the doctor. A lot of people don't realize your doctor cannot read your mind. That's still a very common. I saw that when I first went to nursing school 40 some years ago, and it's still out there.
Doctors
So
still can't read your mind.
now they didn't teach that in medical school. We're lucky that they began to consider healthy food, and things like that. Um, and Jefferson has come a long way. The whole Jefferson mainline health system. They actually have there's a holistic integrative medicine center at Jefferson that's available to anybody who's going through cancer treatments to have
Wonderful.
acupuncture, things like that. A friend of mine founded that, and then I was recently in Bryn Mawr Hospital, and they said, "Oh, we have an integrative medicine department. What would you like?" So it's changing. It's nice, but they can
Yes.
bill that as like the dessert or something with the dinner. You can't bill for it individually.
Right.
Uh,
Right.
yeah,
And I know that it's just a system wide thing. All the doctors and nurses would support all the things that you and I might discuss. It's just the system isn't supporting it presently.
right. And you
So
have to
in
pay.
time, they're working, like you said, these integrative medicine centers and so forth are working on it. What's ended up happening, I think, is a lot of people will do what they call the out of pocket care for themselves to stay well, so that they don't have that major problem, and they do things like you said, acupuncture or nutrition and the yoga and all these different things to stay healthy, and that's kind of what we're after.
Right. Okay. Well, that is probably a good time to stop for our first sponsor break. So I'll let Dan take it from here for a minute.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery, or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick, Wednesdays 7 p.m. Eastern on the Bold Brave Media Network and TuneIn Radio. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them. Rediscover and assess their core values, philosophies, and competencies. Find settings that allow them to be the most productive and track their progress towards accomplishing goals. Listen to John Hawkins' My Strategy, Saturdays, 1 p.m. Eastern on the BBM Global Network and TuneIn Radio.
Hi, it's Peggy Smith, your holistic nurse, and our guest today is Dr. Robert Butera from the Yoga Life Institute.
Yeah, well, Peggy, I'd like to share with you a story that'll provide a lot of information from one of my first yoga therapy clients when I was doing my PhD in San Francisco. This is from 25 years ago. So she is long since enlightened and probably retired and not worried if I mention a few words because she's given me permission to talk about this. It's been a while. So this woman is an editor. She's all of like 5'2", very slight, because this part of the story. And she lived in the neighborhood where I was, and I was teaching some classes on my own at a church. And she came over to these classes and told me that she gets very nervous because she's an editor and she's like a copy editor. And she has to finish a certain number of pages in order to earn her paycheck. It's very pressured. And it's every single day that she has to finish these things. And if she makes any errors, she could either lose her pay or lose her job. So it was very pressured. And she was very, like I said, very slight and kind of nervous in her behavior. So she started doing some yoga. And when I explained the yoga therapy, she was very fascinated. And we started to discuss the anxiety that she felt because, as you can see, whenever we have anxiety because we're nervous about an outcome, the anxiety actually makes us possibly fail because we're so nervous. And then she's going to be more prone to making a mistake. And then she just overall wasn't happy. And I think she was especially thin because her stomach was probably upset a lot. So we started examining and exploring what was feeding into this. What was this fear? And as we got through to that, she was, obviously had legitimate fears, as I just described, about the pressure she had. And what we did in this case was we tried to shift her mindset from, say, like 12 o'clock of fear to 6 o'clock of happiness or joy or flow state consciousness. You've heard about that, like you're getting your hypnotic higher state of consciousness. So to achieve this, she would do a yoga practice in the morning and the night for about 30 minutes, where she did some breathing and some basic yoga. And then we did an exercise to develop concentration, which is balancing on one foot with your eyes closed. And this was her signature thing. And then we decided, we met at once a week for a number of months. And she would practice different things and we would discuss and so forth and make sure all of everything was going well. And she started really liking this balancing exercise because in order to balance with your eyes closed, we're not going to have you do this in front of everybody right now, Peggy. But if we did, I guarantee at first it'd be very hard. But because when you close your eyes, you start to sway and you don't have your eye and your vision to show you how you're swaying. So you don't know where to compensate. So you have to feel your body in space. So that means if you think about anything else other than balancing, you will lose your balance and have, the 1 foot need to come back down. So she got to the point where she could do this for 5 minutes without falling.
In the airport line when they want you to take your shoe off. They wouldn't let me hold the table. I kept saying, I'm an old lady. I can't do 1 foot.
So she could do it with her eyes closed. So she learned deep breathing. She learned all these yoga positions that allowed her to strengthen and get to know her body. She started learning about meditation, where she would kind of calm her mind, but the balancing was her anchor, because if she thought about anything else, which was like an anxious thing that she was prone to doing, which was her worry. The balancing would break her worry, so we had her do it 4 times a day. Everybody gets a break. You have to stretch out. So she would take a break at lunchtime and in the afternoon and in her morning. And she would do this practice to the point where she got really good at it. So she got used to feeling her mind be stable, because that was the key for her. And then what do you think happened? Her confidence level, like, just soared. And she made a joke on one of our retreats that had the entire group laughing for 5 minutes. She said, she taught us, I had her teach us the balancing because she was, as a way of like celebrating her. And she said, everybody, the other day I was walking down the street, and I often get scared when I walk down the street if I see big men or I'm very small. And she said, but I don't feel scared anymore, because I was going to walk up to this big guy with big muscles and everything. And I was going to say, do you want to have a balancing contest with your eyes closed? and, and we all laughed, knowing that she would probably win by far. And just, if you knew her and how frail she was, to having her gain a few pounds, having her like, she actually gained a little bit of weight so that her weight normalized because she was underweight. And then you watched her confidence level soar. And then she learned to concentrate her mind. And then, while she still felt the pressures from now on, off and on, but she was always able to come back to her true self. So that is kind of an example that shows you that our mindset is really where it all starts. And then we use the different yoga practices to support that mindset.
Okay, I often, like, if somebody has a needle phobia and getting ready to put an IV in or something, or they're anxious about any situation, I just remind them that the anxiety is usually worse than the actual event. But
You're always full of those good wisdom statements.
so yeah, because there's a lot of misconceptions, I think, about yoga.
Yeah.
For instance, the larger population feels like they're not welcome, or they couldn't. Can you say anything about that? Because it is not
Absolutely.
true thought. Yeah.
Absolutely. So I'm working on a course right now that describes the 8 steps of yoga. And so this will help everybody. So the third step is the yoga pose step. And what I want to remind everybody is that the 7th and 8th step have to do with the meditation and, like, the developing a concentrated, mindset where you're not disturbed by anything. That's the goal of yoga. So anybody can achieve that. The nice thing about yoga poses is, although you see the cool pictures of somebody doing some crazy twist or standing on their head or whatever, and those are like gripping images, the nice thing is we can adapt yoga. For example, seniors do chair yoga.
Right. A lot of the facilities I go
You'd be
to.
surprised. These days, like, every fitness club has yoga. That's going to be fitness-based yoga. That's going to look a little harder than when you go to a senior living center and you see people doing chair yoga, but they're having a blast because they're moving their spine, they're strengthening their core, they're doing some deep breathing, they're being in touch with their body, as I was describing before in the story. So we can adapt things, but you always want to remember mindset is the key, and that is, available to all of us. And then we just adapt the yoga to different audiences.
Okay, and I guess, I mean, sometimes at one facility I go to, they joke about how many people crack when they're doing those poses. Uh, and wondering if like the arm's gonna fall off or something. But they do love it. They feel so much better. They're happier,
Right.
more
So the
active.
practice is right. So typically, when you just start moving and you create circulation in the system, that certainly helps. But also think about it, and I think this is true, with most, like, coaches or exercise professionals, teachers. it's just nice to be in their presence, and it's nice to be with other people doing healthy things. So it uplifts your spirit by having, other people around doing the same thing. And that's where I always say that's that mindset that's the key. They could be doing any sort of exercising with a teacher who's then doing a little deep breathing, who's bringing that peace of mind, but also a little bit of joy. And, laughter can be happening. And then you're exploring things and you're with other people. And that whole process, especially for seniors, but is good for all the different groups. Yeah.
Yeah, I recently had an oncology patient, a young girl who actually was very active, physically and everything, bodybuilder even, and she was so depressed that she couldn't do anything physically. And I suggested, well, you could start with yoga. And she said, well, that's not real exercise. And but she actually did. She got herself a video online, and was trying it. And she said, it makes her feel like she's doing something to help herself. And with a lot of the complementary techniques and things that we teach, I tell people that even if I'm not sending people to Mexico for some outlandish treatment, but even if it didn't do anything physically, you could measure with labs or anything like that, it communicates to your mind that you're trying to help yourself, and the mind wants to please. So
That's right.
that really,
Absolutely.
the mind,
So I think there are a couple things if we go down that route and we get a little sciencey. Okay.
okay. Hmm.
So if you think of the systems in your body, right? Heart rate, bones, digestion, right? Skin, all these different systems. There's only one that we can consciously alter, and that's our cardiovascular through our breathing. And if I can take my breath, they say in the medical field, the average breath is 2 seconds in and 2 seconds out.
Right.
And that's considered normal, but it's not optimal. It's just considered average because that's what people do. Because think about the size of your lungs. You have the upper chest cavity, you have the midsection, which we call the intercostal area, and then you have your lower diaphragm area. We teach people, for example, with deep breathing, to breathe in 15 seconds and out 15. The woman in that story, very petite, not athletic lady, she could
Right.
breathe 20 seconds in and out. So when we do that and we fill the bottom, we expand wide, our body gets oxygenated much better, and it also gets the CO2 out. And then when you move your body, you create all kinds of circulation. So your lymph flows. We have a lot of lymph nodes
Hmm.
in each upper and lower end of the torso. So when your diaphragm is moving back and forth, your chest is lifting a little bit as you breathe, tremendous number of things are actually measurable. Blood pressure normalizes, circulation increases, right? Your
Right.
immune system has been shown to be more effective with the deep breathing. Your mental clarity improves, your energy improves because then you have more oxygen. There's
Okay.
so
We're
many
going to
benefits.
stop right
Yeah.
there. If you can hold that, hold your breath until we come back. All right.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet every Monday at noon Eastern on Dancing with Words, Dancing with Wisdom on the BBM Global Network as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
And Bob is back, still holding his breath. You can breathe, Bob.
Thank you. So you wanted to talk a little bit about
Well, since
medical.
the different type of medical problems people might come, menopause is a good one that it helps with. People that maybe have some spastic physical problems, cerebral palsy, things like that. If you had clients like that, that might be more like the chair yoga, or they have to have an assistant with them moving their body parts. But a lot of people think that it's a very small community that can really partake or even afford yoga. And I think having classes and all online, and even things on YouTube that's available has made it a little more accessible, at least gets people some confidence in the home, and then they might go to a class,
Yes.
like I said, do you work with eating disorders? That's another common problem that I think would be very helpful.
So couple responses to that. When a yoga therapist works in a hospital setting, they're obviously under the doctor's care, and approval and everything is set up. And what that yoga therapist will do, similar to like a nurse who specializes in a specific field, they will become very educated. We have a number of yoga therapists who work with cancer patients or diabetes, heart, all kinds of different, situations. And when they're in the more critical time of care, they're working under, beneath the doctor or medical staff. However, the majority of our clients will be when a person is out of the crisis time and they're in the maintenance and they've been released from physical therapy, but they're not 100% in terms of function where they want to be. Or they're managing their asthma or their anxiety. What did you bring up? MS or any number of conditions. And what the yoga therapist will do is become very educated in that particular topic from experience and their own study. And then they will work the way that a kind of a yoga teacher would work. Whereas the client would come to you, there wouldn't be medical supervision anymore because the client would be somewhat functioning well, according to the medical field. But they would want to stay well or maybe improve. Like I helped a man who had long COVID. He was in a hospital bed for 30 days or 3 months.
Okay.
And then he had physical therapy that helped him to regain walking. But the walking was really like shuffling. It wasn't completely, back to that person's ability prior to this episode of COVID. So I helped the person, first of all, overcome the frustration. There's always a mental component to these things that limits us. So we always start there. We always start mind first, body second. And once I got the motivation, we then did like one area of walking in terms of yoga, understanding how the feet work, feeling the legs, feeling the knees, feeling the hips. And each session we went slowly up. And now the person is trying to walk like a child with bouncy steps as opposed to shuffling. So hopefully, does that explain how in a medical situation when somebody is like getting cancer treatment or something, obviously the therapist is working with the nursing staff and the care staff. And then when the person's released from their treatment and they're basically again functioning, we'll then be there to take them to a higher level.
Are there studies ongoing, like to support the uses in these different disciplines and everything, to give evidence-based research to to validate what you're doing? I mean, it works
Yes,
and everything.
yeah, right. There are various studies that have been carried out. You know, the broad type of studies that would be extremely pervasive have only been really covered with heart care.
Okay.
There's Dr. Dean Ornish's program for heart care has been researched exceedingly well. A lot of things in the field of mindfulness incorporate a lot of what we do. And so a lot of the mindfulness practices have been discussed with things, mental disorders like anxiety and depression.
Okay, we will be
But
having on a future show the Integrative Psychiatric Center in Devon.
oh,
Debbie
nice.
was on our show at one time that will go into that.
Yeah. So
I was
there is a lot of
thinking
that. Yes.
population, autism comes to mind. Is there any, has that been explored there with those people? I mean, it's harder to get,
Yeah. Yes,
that's the
I
population
mean,
I think that could benefit. We could all benefit, but
honestly, another avenue or like a lens to think about this is just stress in general. So if you
okay.
just think of stress, and let me define what I mean by stress is you have a situation in life, and I'm going to say it's like a fist, it's a tough situation. If it's a difficult situation and I don't like it, I meet it with another fist, and then I have friction and I have all this stress. So if we're always going to have stresses in our life. If I learn how to greet it with an open hand and I just embrace it, now it's a difficult situation that I'm managing.
Okay,
So
that's a good description.
every one of those people in that you're mentioning, all the different types of conditions, they all carry inherently a stress because the condition is not what we really want. We don't want to be sick. We don't want to be, dealing with something. But as we can accept it, then we can decrease the stress level. If we use these various yoga practices, they have all been proven, right? Mindfulness,
Right.
breathing, relaxation, moving your body, and exercise. All of these things have been proven to lower stress. And then our system, like when the stress goes down, all the functions in the body increase. So, whatever the condition is, if we can decrease our stress, we allow our body to be stronger and healthier in relation to it.
Okay, and I think there I'll interject, stress is actually one of the leading causes of cancer as well as heart
Yes.
disease.
It's like the invisible cofactor. We have all these modern conveniences and everything, but people seem to continually be stressed. So I can share like for example, I have a book, The Yoga Life, that's
Mhm.
and
Right.
what this book covers is every area of your life, and we look at it from that point of view of where there is like a friction and how can we decrease that. So how can we do things like eating well without making it disrupt our lives? How can we think about money, which is a huge area of stress.
Right.
And we find, for example, it's not if you have a lot of money or a little bit of money that you have stress, it's just your relationship to it.
Okay.
Friendships, exercise, being out in nature, all these different things, when we start to align them with like what we need optimally, um, we just function better. And they'll be like, oh my gosh, I don't need this medication anymore. We've had so many people who just do simple things. They stop eating certain foods that we know are called junk foods. They start exercising more. And any one of these things alone may not be a game changer, but together They start doing the deep breathing, they start relaxing, and then they may stop certain habits that they don't realize. I don't have my cell phone in here. I like to show that. But
Right.
that whole technology, your
Yeah.
eyes are straining, your brain is straining, and people at this time don't realize that when we're given so much information, that's actually creating a stress in our nervous system. So
Okay.
as we get people to behave a little differently than what the culture is doing, since the culture is giving like stress to all of its members, we have to do something slightly different to get out of the way.
Okay.
See what I'm saying? Because
Right.
like, think about every field, every profession. Nurses are all stressed out because
Very much.
they have, right?
Yes.
Business people, they're always trying to meet their sales quota, or the serve their customers better, or they have competition, and then they're stressed. School teachers are stressed. Which field isn't stressed? Forest rangers, maybe. They have a pretty stress-free life, but like, who has a stress-free life? Almost everybody is the opposite of that, going very quickly. I have to pick up the kids, I have to go here, I have to take care of mom. All these things are like pulling a person in all these angles. So instead of having a joyous advanced society, we have a advanced society with all of our technological innovations, and then we also have an equal level of stress. So what I like to tell folks is that you've got to come up with something different yourself in order to find joy and happiness and more health. You have to have a good sense of humor like Peggy.
It's all about balance too, I guess, because we get all these great ideas. January everybody joins the gym, and I remember years ago I signed up for Planet Fitness and it was $10 a month, but if you took a guess, it was 20. I figured I'd never go by myself, so I started paying 20 a month. Well, I never brought anybody either, and people they know that they bank on you not coming. Um,
Yeah. So
but
it takes a plan, and that's why I always feel inspired about, like, I think one of my, aside from general education and inspiration
right.
and such, training yoga therapists who then actually help people make these plans that I'm describing, like, how can I live a healthy life? Like, what can I really do? Because it's not given to us in school. It's not given to us at the workplace, because what's given to us is the recipe for how to be stressed.
Right.
So we can't expect everything to be perfect in our lives, I guess. So we have to take some things under our control. And that's why I say, be a student of health.
Okay. And since you said in the beginning how you view this as complementary, I just want to interject there your example of the student that didn't need her medicine. I want to suggest that people shouldn't make any changes without talking to the medical provider who
Oh,
prescribed it.
yeah, absolutely. So one of the things I do with people who come in for yoga therapy, who may be like, it's very common that a person will be on 5 or 6 medications.
Right.
And oftentimes the medications are offsetting complications or side effects of other medications. So what I always like to do is ask them first, have you talked to your doctor lately about your prescriptions? And almost always the answer is no. So then I say, well, go talk to them. And the second thing, and that's why some people get off of medications, because the doctor says you shouldn't still be on that.
Right.
And then the second thing I tell people is, do you know the side effects and the ramifications and the reasons you're on these medications? And the answer is, again, often no. So it's just about education and taking back your power. And then when I get the person, I like them to get checked by their doctor. And when they start to do the various healthy interventions, they will often go back in 3 months or 6 months to see their doctor. And they'll say, well, how are you feeling? How's your mood? And she'll say, well, I feel really good these days. I'm really enjoying my life. I'm doing yoga. I've been getting outside. I'm back into all the things that I love to do. And I feel better. He says, well, then we should take your depression medication and let's lower it right now because it doesn't sound like you are depressed right now. So I've had people be on a antidepressant for 10 years and never think about going to therapy or approaching it. And all of a sudden they do their yoga therapy. They talk to their doctor, like you said, never do these things by yourself. And their dosages go down. And then eventually a year later, they're gone. I've just seen it so many times. And it's really obviously gratifying because that means the person has elevated their mood.
Right.
They've taken, their health is better. They've lost some weight, maybe. They don't need the blood pressure medication anymore. There's all kinds of wonderful stories. There's a lot we can do.
Okay, and we're going to take one more break and then we can close, maybe sum it up of what people can do. Different parts of the country have different things that are not as accessible as California or New York. So maybe you can talk about that.
Sure.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet every Monday at noon Eastern on Dancing with Words, Dancing with Wisdom on the BBM Global Network as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
And we're back again with Dr. Robert Butera with the Yoga Life Institute, and he's just going to kind of sum up the show here for a couple minutes.
Well, we wanted to give you all a few resources now that you're so excited to jump into some yoga. And first thing I'd recommend you can do if you have a particular health condition, and as Peggy was saying, sometimes the bills mount up and just hiring some private teacher can be out of reach at the moment. If you type in like yoga practices for, and then your particular condition, you will find out that there are so many resources of people specializing in different areas that they may have short 15-minute yoga practices or breathing or meditation practices that are free online. Oftentimes a resource like YouTube or other platforms will offer all sorts of classes. One guy told me that's how he got out of anxiety. He had agoraphobia, afraid to go out of the house. He tried a yoga class online, felt great for a couple hours, started getting into it. Then he went to a yoga class. Then he became a yoga therapist in a few years. The other thing for yoga therapists, there's an organization that has a listing, like a lot of our graduates are on this listing. It's the International Association of Yoga Therapy. So IAYT.org. You can just look up the Yoga Therapy Association. And then you can find a listing for different yoga therapists in your area, different people that have been trained in the 800 hours, as I've described. We've trained people all over the country now, but so have other organizations. So there are resources like that.
Okay.
A lot of YMCAs, Peggy, will have, where you may already be a member. They often have different classes for different age groups.
And a lot of
Yoga
senior
has
churches already pay for those memberships. Yes.
a lot of senior centers, even not just care centers. They will offer a yoga, different types of meditation activities. So hopefully
So,
those would be some good places to start, or you can just call Peggy and she'll tell you about one of her friends.
so another resource which has helped along with yoga and meditation on YouTube is binaural beats meditation, and they have them for every single medical condition possible. Some
Right.
of them as long as 8 hours. If you're and I've never listened to one show completely because I'm usually asleep. Less than 10 minutes once they start. But
Yep.
uh, So I hope this has been informative for everybody. You can reach us either on Bold Brave TV or myself directly. You have the Yoga Life Institute's website, and our goal is to keep getting healthier and healthier, so we don't have to let the politicians run our medical needs.
That's right. Well, thanks for having me, Peggy. It's great to see you.
Yeah, this is a
And
wonderful show you have. Thank you. I appreciate you coming on for us. And
you bet.
we looking forward, we're going to be having somebody that does acupuncture. We're going to have an animal communicator, a holistic vet. I can't go without that. Integrative medicine doctors. We're going to have some things talking about specific conditions and how you can do things holistically with that. And it's going to be an exciting year. We have the whole year planned out. So I'm glad you were part
That's
of it, Bob. I
fantastic.
appreciate it.
That's
Glad you're
fantastic.
back in our country.
You've got a new
So
job as a TV host.
actually, I had to cut back on the other stuff, yes, because this does take time, but it's a lot of fun. I'm having more fun, it's the only other job that was this much fun is being a hospital clown, which I'm still involved in. In fact, we're going to have the clowns on our show too at one point. So talk about humor in
There is
medicine.
a chapter. The laughter is also one of our chapters.
Okay,
Being childlike and laughter. I think obviously how healing laughter is.
right. So well,
Absolutely.
that's great, and I hope you stay healthy. Don't fall
Thank
off the
you.
earth when you get the big earthquake.
All
Or
right.
so,
All right.
all right,
Great.
stay healthy and say hi, Kristen. All right.
I will. Thank you,
Okay.
Peggy. Take
Thanks
care.
for coming on. I appreciate it. Bye bye.
Bye-bye.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, noon Eastern on the Bold Brave TV network.